So today we are going to be talking about prenatal diagnosis. Prenatal diagnosis. What is prenatal diagnosis? It is basically the diagnosis of disease of a fetus or a person who is not still born. Okay? So that is the prenatal diagnosis. So why prenatal diagnosis is needed? When a woman of greater than 35 or 40 years of age conceives, she may give birth to a defective baby. So, to avoid that kind of birth defects, prenatal diagnosis is needed. And also, there are other factors that can lead to any kind of birth defect. For them also, prenatal diagnosis is important. Basically, as a basic idea, prenatal diagnosis, the tests that are involved are amniocentesis and ultrasound. Let's proceed. So, if we see the uh, birth defect that can occur according to the week of from when the female was conceived, initially the chance of defect increases and then decreases. So, on around 8th week or 3 to 8th week, the chance of formation of defect or starting of defect increases, and after that it decreases. The cause of defect may be environmental, may be genetic, or may be any kind of minor anomaly. So, what are the main cases in which we need prenatal diagnosis? The main cases, as I told previously, if the mother is greater than 35 years old or 40 years old, then it is needed. If the family has any kind of history of congenital anomalies, then it is needed. If previous child was defected or the abortion had occurred for the in previous case, then the prenatal diagnosis is needed. If the mother has any kind of diabetes mellitus or phenylketonuria, or if she got any kind of infection, or she has taken any kind of teratogen, then it is needed. And if there is some something that is not normal is seen in ultrasound results, then also prenatal diagnosis is needed. And also, if there is a genetic disorder in population, then also we need prenatal diagnosis. Now, what are the main tests or things that we do in prenatal diagnosis? The main things that we do in prenatal diagnosis can be divided into three categories. One is invasive, another one is non-invasive, and in between of them there is minimally invasive procedures. The invasive procedures are amniocentesis, chorionic villi sampling, what are this? Invasive. Let's talk about invasive procedures. Invasive procedures. Invasive procedures are amniocentesis, chorionic villi sampling, fetal blood sampling, Okay, there are other invasive procedures also, but I am not listing here. Now talk about minimally invasive. The minimally invasive procedures are obviously maternal blood screening. Maternal blood screening. Why it is minimally invasive? Because you don't have to invade to the fetus. You can take blood from mother from his arteries. Yeah. And from the mother blood you can check for circulating fetal cells or circulating free DNA of fetus. You can other thing that we can check is alpha feto sorry protein. Also pregnancy associated plasma protein A. Also you can check in heaven A, estriol and many other things. Okay. Now if maternal serum contains alpha fetal so if maternal blood contains alpha fetoprotein then it suggests that the fetus may be defective or there is a defect in fetus, because alpha fetoprotein is a major protein in fetal circulation. So if this or in fetus, you can say in fetus. So if this leakage is happening, you can suspect that the leakage is from neural tube only, and we know the defect of neural tube is anencephaly, mainly anencephaly and spina bifida. So the fetus may develop anencephaly or spina bifida, and also it indicates the fetus may have Down syndrome. Okay. Now let's talk about ultrasound. In ultrasound we use 2 to 18 megahertz of frequency. It actually receives the echo or reflected sound waves and generate image. Why it is important? It is very much efficient is because it is safest, easiest, and also it can give real-time imaging. So it can give you the gestational site where the fetus has implanted, and it through the ultrasound image analysis you can estimate the age of fetus also. So that's for today. See you in the next video. Bye bye.